What sort of strategies do you use to help patients maintain or engage with physical activity and exercise? Because that's another thing that everybody struggles with.
One of the things that makes me smile is whenever you say exercise, people think about lycra in the gym. So people, whenever you say are you exercising, that's where they go. And so one of my big things is I think the best exercise for a person is something that they enjoy, and that exercise is moving your body. So we talk about that and start brainstorming what that might be for someone. And some people love exercise and absolutely embrace the gym and, pay for personal training. And it's a new world for them and they have so much fun with it.
Yep.
But others would hate to go anywhere near there. So we talk about, if they've got grandchildren, go on a pram walk. Push your swings, that's resistance exercises. Just get up off the chair, get moving. And so it's about making baby steps in the right direction and working out what patients can do. Doing some weights or resistance exercise is really important after surgery because we want to maintain bone and muscle health. Yeah. And one of my biggest strategies there is the concept of habit stacking. So actually thinking of when you boil the kettle, do some squats. When you carry the shopping in the shopping bags, do some biceps curls. When you're brushing your teeth, do some heel raises. And so if you can actually use your automated brain to try and link those things together and think about them as little exercise snacks, often I can get people who think they could never do those things.
They can do
something. And the other thing is something like a TheraBand is very cheap and easy to use. So I've recommended some YouTube videos that are safe that they can do with a piece of $15 equipment, which is not a lot of money. They can take it with them if they're in a hotel or in business. They don't need to do that. And, so I've got some other resources, which just gets them started. But the big thing is that everybody's going to be different on what exercise looks like for them. And so it's working out, for someone it might be gardening or going from putting the washing in the washing machine to actually carrying it out and hanging it on the line. There may be other ways to get people moving that isn't lycra in the gym. And I think having an individualised response to that and looking at what they like and what they've liked before can be really helpful.
It is difficult because not everybody has access in their community to all of these resources. I mean, I really like things like for a lot of our older patients, aqua aerobics, because it's such a social thing for them. And a lot of our patients do suffer when they're overweight from social isolation and a bit of social anxiety, and trying to get people to look around them to see what social events that offer exercise is really handy. Those cycling groups, walking groups,
park run, which you can walk or ride,
park run, ocean swimming, aqua aerobics, those sorts of things
are really good. And I think I think too, for some people, meeting someone at a street corner to go for a walk is actually, they're more likely to do it than if they don't, if they just were going on their own. So that can be a really good strategy where you get, and for women, if they just talk and walk before they know it, they've done the exercise. And I think that's safe for anyone walking. The other thing I am very much aware of is they lose a lot of weight in those first 6 months. And so even though I do want to get them moving, they're going to be a lot more capable 6 months down the track than they are at the beginning. And so I suppose what I was talking about before is my early approach is to just get them doing something. Because I know down the track they'll be easier. And they'll often say, I could have never done this with all that weight, but look what I can do, And so it's getting them that sense of hope and actually self-efficacy that they can make change. That is really the secret, and finding something they love doing.
Yep.